ACEs occur in groups. Some ACEs occur more frequently than others, and some ACEs lead to greater risk of additional ACEs. Childhood sexual or childhood physical abuse puts someone at greater risk of having 2 or more ACEs. ACE research has a proven direct link between childhood trauma and poor later life health outcomes and adult well-being due to the adult onset of chronic disease, depression, suicide, being violent, and becoming a victim of violence. In fact, many health outcomes are adversely affected by childhood experiences. With an ACE score of 4 or more, you're twice as likely to become a smoker and 7 times more likely to be an alcoholic. You're 460% more likely to suffer from depression and 3 times more likely to need antidepressant medications, and an astonishing 1,200% increase in risk of suicide attempts. An ACE score of 4 or more doubles the risk of heart disease and cancer. People with high ACE scores are more likely to be violent, to have more marriages, more broken bones, more drug prescriptions, more depression, and more autoimmune diseases. ACEs is directly linked to opioid dependency and addiction as well. People with an ACE score of 5 or higher are 7 to 10 times more likely to use illegal drugs, to report addiction, and to inject illegal drugs. Opioid-dependent individuals report higher rates of ACEs and are associated with an earlier age of their first use, and they are at greater risk of injection drug use and overdose. Women are greatly impacted as well. They are 5 times more likely to be a survivor of domestic violence and 9 times more likely to have been a victim of rape. Juvenile victims of human trafficking have been found to have a higher rate of ACE and a larger number of ACEs, with sexual abuse leading to girls being 2.5 times more likely to be trafficked, while boys are 8.2 times more likely to be trafficked. While these are some huge and terrible numbers, what do these dramatic increases really look like in a child? For example, a child has an ACE after being physically or sexually abused in their home. Because of that, they have impaired emotional and social functioning because they've been raised to believe that the very same people who love them and care for them also are violent towards them. They begin to equate love and violence as one and the same. As they grow older, they may start to use self-coping mechanisms, such as drinking, to ease the pain of what happened to them. And as we've learned, this may put them at greater risk for liver disease, and then once that child has 6 or more ACEs, they are at greater risk for early death. Kids with ACEs are also more likely to get sick from run-down immune systems. They're more likely to miss school, to act out, and disassociate. These are the kids we have been misdiagnosing as having ADHD or ODD, when in reality, they have been victims of multiple abuses and dysfunctional homes. The costs to society are great as well. This costs the American economy $1.5 billion each year in expenses to child welfare, hospitalization, mental health, law enforcement, and lost worker productivity. Imagine those cost savings. So how does all this happen? You see, ACEs creates toxic stress in children. These kids grow and develop constantly under the threat with regular triggering of the fight or flight instinct. This constant stress damages developing brains and the bodies of children, overloading stress hormones, causing brain synapses to misfire and shrink, and creating post-traumatic stress disorders that unfortunately never has a post. Bodies become damaged due to constant presence of adrenaline and cortisol, which is produced from this fight or flight that now creates high blood pressure, which weakens the heart and the circulatory system. Glucose continues to be excessively produced to provide enough energy to quickly act, which becomes type 2 diabetes. Ultimately, adrenal glands give out, and the body loses its ability to fight back. Finally, this results in toxic stress, which alters our DNA that's passed on to our own children and leads to our own early death.